gloves भी दे दें.
7.5 years.
Can you hear me?
Yes.
Okay, good.
Do I need to suck it out?
So, did you guys get the history on this patient?
No.
Okay, so वो किधर गए हैं डॉक्टर साहब?
इधर आइएगा मैडम.
ये ज़रा हिस्ट्री बता दें इनको ना.
रीमा एक ट्रिप बना दे बेटा.
She's a 60-year-old lady who presented to us with symptoms of obstructive jaundice for the past 1 to 1.5 months. And her ultrasound shows that CBD is dilated up till 1.5 centimeter and it cannot be traced beyond the porta hepatis. So now we are going to proceed with the ERCP.
Thank you. So you can hear me, right?
Loud and clear.
Loud and clear. So history, it looks like obstructive jaundice, and not sure. I think to me it looks like a hilar stricture probably, and we'll see what the cholangiogram shows. But okay, so okay. You see, you're going. You see the scope there. So
I thought the CBD was also dilated. So
yes, CBD was also dilated.
Yes,
So whatever movement of your, whatever you make, there should be a purpose to that. Okay? It should not be just like a purposeless movement. So here, I don't know where you are. I know you are somewhere in the interim. That's what we saw last. But if you don't see that, then you're not going to get anywhere. So whenever you don't see anything, you come back. Big wheel away from you. Thoda sa big wheel. Let's get back to the original position so we can see where we are and follow it again.
There we are. Folds
So
go on the right.
हाँ जी. Good. Suction कर लो ये थोड़ा सा fluid. Okay. Now you see which way to go. ठीक है. Suction करो. Good. अब यहीं पे जब suction कर रहे थे, fluid now inflate the same. Don't move from that place. Inflate it there so you know exactly where to go. Up now follow and now go towards the ankle, towards the pylorus. Good. Pylorus is underneath, right? You see that? Okay. So big wheel towards you. Don't push it yet. Okay. So big wheel towards you. Now push it. You're straight into the dwar now. Okay. Inflate. Big wheel, a little bit away, yeah, up to get an idea where we need to go. So there's a very edematous area right there. So I don't know if it's maybe a tumor at the bottom as well, like a pylorus. I mean ampullary. So keep going. Okay, gently. Keep advancing the scope. No, not that movement. So it's right in front of you. So doing this is no good. Okay. So big wheel towards you.
Big wheel towards me.
Okay. So gently advance the scope. Lumen is right in front of you. Advance the scope. Big wheel just towards you. Nothing else. Okay. Now advance the scope. Advance the scope is pushing the scope in. Okay. Okay. Now small wheel away from you.
Small wheel away.
Lock it.
Locked it.
Okay. Now
Clockwise.
shorten the scope clockwise. Okay. Yes.
Okay, only this.
Okay.
Blind.
You know, we would like to see it, but okay.
Not happening.
Inflate,
So should I let it
inflate,
go?
inflate. Air नहीं जा रही.
Check it outside.
Come back back or do something different so you can see it. Okay, big wheel away from you.
Away.
Okay, okay, stay there. Yeah. Quite edematous, so what I'm worried about is there is a tumor at the bottom.
Okay. Now it's inflating
So where is the lumen?
over there.
Okay,
around.
go in. Okay,
This is involved. The lumen seems to be involved.
okay, now go back in there.
Big wheel was up
Yeah, big wheel towards you.
towards me.
Okay, okay, now go back to the duodenum. Big wheel towards you. Big wheel towards
Towards me. Big wheel up. Away.
हाँ जी lumen देख लो ना मेरे भाई तो do something different like to see the lumen.
Big wheel away. Big wheel towards me and small wheel locking.
Why you're in the duodenal bulb? How you are gonna go into the how you are gonna reduce the scope from there?
I think it's involved. The area is involved.
Yeah, but you are in duodenal bulb, so you won't be able to reduce the scope from there.
Go ahead.
You have to go a little bit deeper.
It's not going by.
Yeah, I think
And
it's
I'm
a
in
tumor.
resistance.
Tumor
It's a
there.
resistance, so I need you to take over.
I think I am not sure. Looks like there may be a tumor there at the bottom. So let me just take a look at it and see. आप जब जो है ना ज़रा note करना कि what movements I'm doing with my hands. It's important to take a look at screen, but at the same time, what I'm doing with my hands.
I think it's you know the way you make it, the way you use your left hand, and the way you keep your scope. It's really very useful for people who are not that tall and who can actually literally do exactly the same thing as you would, keeping the. That's well shown, Khalid.
So just like look at that scope is in this. Wheels are facing up. Okay. So you see the pylorus right there. Yeah. So I'll go in there. So you see, I don't move too many movements. It's a very stable scope. I'm just following the lumen, okay, and adjusting my scope a little bit. And everything with what I'm doing with the scope is purposeful movement. Yeah, I think it's a tumor right there.
Was this supposed to be an ampullary growth?
And yeah, looks like. Initially, the way they said in the ultrasound, I thought it would be a hilar, but the CBD is also dilated. So they said they cannot trace the bile duct above the in the porta hepatis. So that would indicate. I think that the ultrasound report is kind of misleading.
Yeah.
Yeah.
Uh,
So it's all
30
a
to 40%
tumor.
ultrasound reports, in our opinion.
And but they also say like the CBD is 1.5 centimeters, so that indicates it's lower problem.
Yeah. Great. Khalid, do you use fluoro at this stage just to
Yeah,
see?
and, that's one thing we can do. Use fluoro. Fluoro को जरा set करना.
In these situations, Khalid, I find the small scope very useful sometimes.
We have a small scope.
I think we do, but I'm not sure if it's. I've just got it for the unit, but there was some issue with the buttons. Wasim, छोटा scope functional हो गया?
Not yet.
Hey, yaar, what? I want it functional tomorrow morning. So you have today, please.
जरा fluoro दिखाना. It's really, even if on fluoro, if you look at the lumen,
Yes.
the distal lumen, you don't even see that.
Yep.
And so this is all ampullary involvement and D2 involvement by the tumor. you're right. Like it's a really completely almost a bad blockage there. You see that tumor there on the
Yes, we can see it
yeah.
clearly.
So
Yeah.
it's in the
Pretty bad blockage.
Pretty bad blockage, really. फ्लोरो दिखाना जरा मैं कर लेता हूँ छोड़ दो Yes, you see that I put an air in there and look at the lumen, duodenal lumen. You don't even see that. There was a briefly that came right there. You see the fluoro? Fluoro nazar aa rahi hai aapko? Or you look at the duodenal lumen.
Yeah, it's a complete
It's
block.
like complete, almost complete blockage there. So it's gonna be, I think, not a good case.
No.
I think we
in
need to-
terms of the workup, as this patient has not had a CT scan or anything, right?
No, I don't think she had a CT scan. No, it's just the ultrasound. That's what she had. I think needs a
So
CT
we need to
scan.
do a CT scan and then move.
Yeah, I think this might be a case where they may have to do a PTC on her.
Yes.
Okay. So I think there's no need to waste time here. We should move to the next case. Everybody agrees?
Sorry?
We should move to the next case.
Yes, absolutely.
Okay, there's no need to waste
No,
time
no, no,
here.
no, not at all, not at all.
Yep. Okay. Sorry, आपका दूसरा अगला वाला केस आपको करवा देते हैं. मैं ये स्कोप निकाल लेता हूँ तो अगला वाला का केस भी आप कर लो. I don't think this